Are you having some hip flexor tightness with low back pain? Welcome back to my channel, Annie Pilates Physical Therapist. This video will be focusing on low back pain with hip flexor tightness, and it's Pilates and physical therapy based treatment plan that you can do in the morning or in the evening before you go to bed. So get your mat ready and join me. So let's discuss about the anatomy of our hip flexors. So there's a lot of hip flexor muscles, but we're talking about the deeper hip flexor muscles. The iliacus, which is the iliac crest, originates on your pelvic bone, and your psoas, which originates all the way from your thoracic T12, L1, L2, all the way to the transverse processes of L5 level and the lateral disc, all come together and inserts on your lesser trochanter of your femur bone that helps our past 90-degree hip flexion. So if you're tight there because of sitting down on your computer all day or driving, and it causes this, we call it anterior pelvic tilt with increased lumbar lordosis. So if you have this increased lumbar lordosis because of your hip flexors are tight, then you're gonna have some low back pain. So we need to stretch these hip flexors as well as to strengthen them, because we call that tight weakness. So lie on your back. Let's engage our core muscles. Always remember, when you engage your core, you take deep breaths. So engage your diaphragm and your deeper core to protect your spine. So inhale through your nose, belly button in, and blow and squeeze your glutes. Again, take a deep breath through your nose, belly button in, and engage your glutes. So now we're gonna start with single leg raise up. Take a deep breath, and when you pass 90 degrees, you stretch first your hamstrings, and then we're gonna do some small leg circles. So when you do leg circles, you're really targeting your hip flexors, your psoas, your ilacus, and do small and controlled circles, pulling your belly button in to engage your core muscles. My recommendation is to do 10 times clockwise and then 10 times counterclockwise. But if you're tight on your hamstrings and it's very difficult for you to keep your knee straight, it's okay to keep it bent, and as long as you're targeting your hip flexors. So I'm warming up the hip flexors first so you don't strain it when we do deep stretching after this. It's always best to warm up your tissues and your muscles to prevent any strain or pulled tendons. Take a deep breath, one motion, and belly button in. The slower the better, and it's actually harder. When you do it slowly, you're utilizing more of your muscles and you're not using momentum. So slow controlled circles, and then counterclockwise again. So we're doing small circles. So if it's getting tired, you can always lower it and do it on the other side. Always remember, straight leg raise up, stretch a little bit, take a deep breath, and pull your toes towards you to stretch your calf, and do leg circles. And this is very difficult when you're very tight even in your hamstrings. So you're really strengthening your hip flexors because you're counteracting the tightness of your hamstrings. So you take a deep breath through your nose and blow through your mouth. And again, if this is difficult, it's okay to keep your knees bent as long as you're targeting pulling your belly button in to engage your core muscles, and blow through your mouth. And then counterclockwise, take a deep breath through your nose, belly button in, and blow. So after doing the small circles 10 times clockwise and counterclockwise, do this again with a little bit bigger circles, so medium size. So when you do medium size, you're really making your hip flexors really tight. And then you take a deep breath, one circle, one breath, and blow through your mouth. Belly button in, you take a deep breath and blow. Inhale through your nose, belly button in and blow, and then counterclockwise, take a deep breath, belly button in and blow, and down slowly. Let's do it again on the right side, and circle 10 times. bigger circles without twisting your spine. This is very difficult if you're really tight and weak from the beginning, but the more you do it, the easier it gets. 10 times clockwise. Belly button in, squeeze as hard as you can. The slower, the better. And inhale through your nose deeply and blow through your mouth to engage your core muscles. Counterclockwise, take a deep breath through your nose. Belly button in, squeeze as hard as you can. And then down blow. Okay, and you can always progress with your both legs down. And if you try doing that, you can see the difference. It's really much more difficult. So you can strain your spine if you put your leg down straight. You can always go to this level once you've been practicing this at least 7 times already, or 10 sessions, which means 10 days at least before you progress with your leg down. So the last one of really progressing your hip flexor strength is to do bigger circles. So this is really difficult. You can always do this even after a month of doing small circles. So you take a deep breath and make big circles. So inhale through your nose, 1 breath down and out to the side and circle. Inhale through your nose, down and out and blow. Inhale through your nose, and my recommendation, maybe after almost a month doing the small circles, or depends on how much you do your homework every single day, then you can progress and try this bigger circle as long as you're not hurting your spine. If your spine, you feel like a pull on your back, then stop. Again, let's try on the right side, bigger circles. Take a deep breath down. So it's a lot of leg hip circles to target your iliacus and your psoas muscles. And now, after warming up those lovely muscles, it's time to stretch them. So we call this pigeon stretch. Pigeon stretch is really a deep hip flexor stretch. So put your right foot forward with your knee bent. If you have knee pain and stuff, this is difficult. So I'm showing it only for those who doesn't have knee pain. With your hip straight down, knee straight, and you already feel a stretch in sitting up like this. And you take a deep breath through your nose and blow. And the progression in this, holding 10 seconds hold times 10 times, is to go to your elbow and stretch it out. And this is really difficult for most people. After doing this every day, 10 seconds hold 10 times, you can always progress with bending your knee and stretching it out. And you really feel even your quadriceps, your quadriceps, which is one of the muscles, or the longer one, the rectus femoris, that originates also in your iliac crest, gets tight. But if this is really too difficult for you, for beginners, you lie on your side and stretch it backward like this. And you really feel a stretch on your quadriceps as well as your hip flexors the more you push backward like this. So you take a deep breath through your nose, belly button in and blow. Again, take a deep breath through your nose, belly button in and blow, and then relax back. So you hold it for 10 seconds hold, and back to the center. So those are the regimen I'm recommending to stretch your hip flexors. Pigeon stretch, side lying psoas stretch, iliopsoas stretch, or for those who are really not that flexible like me, you go to your lunging position. So 1 foot down, and then the one behind you, so 90 degrees on your right, hip down straight, and then you gently lean forward, and you're really targeting your ilipsoas muscles and back. Always start 10 seconds hold to start with, so it's not too much strain on the muscles, and slowly build up to 30 seconds hold. But for those who are just starting and you're having a lot of pain, you don't want to be too aggressive. My recommendation is the side lying first, and then the lunging position if you don't have knee pain. And then the last one is pigeon stretch, which is really a deep muscle stretch all the way down. And then when you bend, you really progressed and much more flexible. But always remember, you also have to strengthen the hip flexors, so you're not just having flexible muscles. Because if you're too flexible on those muscles without the strength, then you're going to have back pain still and hip pain. Thanks again for watching. I'm hoping you learned a lot about how to stretch and strengthen your ilipsoas. Please like and subscribe my channel. ring the notification bell for future updates just like this one. I upload videos every Wednesdays for physical therapy and treatment plan, and hi Abel! Friday for advanced Pilates or yoga, and Sundays for beginners of Pilates or yoga. Thanks again for watching. Have a great and healthier you. Bye!